Hello and welcome back to the Advancing Healthcare Innovation Show. I am your host, Michael Stamatinos, and it is wonderful to see you. If you're new to us, welcome. Great to have you. We're just really excited about this because we're having some incredible conversations with real leaders that are painstakingly shaping the future of health. So we're passionate about a few different areas. We're passionate about healthcare innovation. We're passionate about leadership, access, and the adoption of these innovations. And if it's your first time tuning in, let me just kind of take a quick step aside here and tell you a little bit more about what we're trying to get done here. So, our focus is on bringing real stories of innovation and leadership to life, not just things that you read in a book, but actually talking to real leaders and them sharing the good, the not so good, the learnings, and giving that space for them to share their stories with our community and ultimately with the world. If you haven't checked out any of our historical interviews, wherever you are, if you're watching this, if you're listening to this, please hit the subscribe button now so that any new interviews come directly to you. So today's guest is someone who understands healthcare from the inside out. Dr. Ngozi Ezike is the president and CEO of Sinai Chicago, one of the most important safety net health systems in the city of Chicago. So Sinai serves on Chicago's west and south sides where the work is hard, the needs are real, and leadership truly matters. Many people came to know Dr. Ezike during her time leading the Illinois Department of Health, where she helped guide the state through the pandemic, which seems like many moons ago, but only a handful of years ago. But long before the cameras and the press conferences, she was a physician. She still is a physician, and a public health leader, and someone who chose to spend her career close to patients and close to communities. And there's many things that I respect about Dr. Ezike, and she'll kind of share some of her story today. But I think what I am impressed upon most is how she thinks about change, not change just for the sake of innovation headlines, rather change that actually improves access, that change that respects dignity, change that shows up in neighborhoods and not just in boardrooms. So she's thinking and acting deeply about what it means to lead a health system today, how to do things differently, how to stay mission driven while navigating real constraints, and how to build trust in places where trust has honestly often been broken. So this is a conversation about leadership. It's going to be a conversation about community. What does authentic community look like? And about what does it really take to move healthcare forward in a way that serves people first, especially those that are underserved and overlooked. So, Dr. Ezike, it's great to see you. Welcome to the show.
I'm so excited to be with you. Thank you so much for having me.
Yeah, of course, it's my pleasure. So uh, when people think and when they hear about Sinai Chicago, they think safety net. What do you wish people understood about what that actually means day to day?
Yeah, I would be happy if someone actually thought about Sinai Chicago and thought safety net, because that would mean that they understand what that means, which I don't think many people do. I think part of the problem is that people don't think about Sinai Chicago. We're in the city of Chicago. We have major world-renowned institutions, and those are the institutions that people think about and really don't necessarily recognize. I say that we're invisible. So we're this great secret that shouldn't be a secret because we actually form the anchor for the city, because our world-renowned institutions couldn't actually do what they were doing if we weren't doing what we are doing, which is focusing and taking care of marginalized communities, Medicaid populations, uninsured individuals. Like, we're doing that. We're the one that says yes when other institutions will often say no. And so we're proud. It's a very special person that chooses to
Yeah.
work in this setting. Um, I think it's very rewarding. I think anyone who comes in immediately sees the passion, but it's also very challenging because as you're taking care of Medicaid and uninsured individuals, it means that fewer dollars are coming in with
Right.
which to provide, the access and the care that's so desperately needed. So it's almost a catch-22 because
Yeah.
you're actually taking care of people who have some of the greatest needs, and you're forced to do it with some of the most limited resources.
Yeah. I mean, just for the audience, I mean, I had the pleasure of just interacting with Sinai for a number of years during my sort of tenure at Hanger Clinic, and I saw firsthand what was being done from a care delivery standpoint, seeing a lot of patients that needed just orthotic and prosthetic services, and seeing the work that was being done over at Schwab Rehab, and the therapists and their level of commitment. It's it's honestly unmatched. I haven't seen many places. Like people are there because they actually really do want to make things better and they want to deliver incredible care to people. And you just, I don't know, you walk in and you get a different vibe, you get a different energy. And even a number of years, since I've left, Hanger Clinic, I still think about a lot of those moments that kind of have shaped me. When you see that up close and personal, it leaves a mark. And you mentioned, Dr. Ezike, like, look, this is hard, but I would imagine that there's also moments that give you hope. Are there any moments recently, like, within the last 90 days? Because obviously there's a lot of weight and responsibility, but any moments that kind of give you hope?
There are moments every single day. Like, it's really powerful being able to round, and it's a relatively big system with, multiple locations, multiple, three different hospitals. And so rounding in different places and just talking to the team, talking to the staff, it doesn't ever happen that you round and don't hear some incredible stories of people who we are able to help that maybe were turned away from other places, maybe have finally found a place where they feel welcomed and know that that is what is making the difference because they feel that we are committed to
Yeah.
their care. Um, People
How,
that we've
when
been
you're
able
walking through,
to.
hold on one second. When you're walking through and you're doing these rounds and you're hearing these stories, obviously there's I call it the FGF, the feel good factor. How do you spread that? How do you spread that like at scale? Do you take those, just internalize those? Do you share them with your board, with your immediate team? And then how do those teams then translate some of those stories across? Because to me that's a form of innovation. That's a form of, recycling this good energy that is required.
Yeah, we think it's, part of the secret sauce to magnify, those wins. And so
Yeah.
every single meeting across our system, whatever group is meeting, like every meeting has to start off with lifting up some of those wins. And so people will share things that have happened, they will share what they've heard happened. I definitely, every single board meeting, start off with some of these incredible stories. I tell my board, you think CEO is chief executive officer. I say it's chief excitement officer, chief
Mm,
encouragement officer, because I want you to know all the great stuff that's happening and get you as fired up as I am to be engaged in supporting this work. So it is definitely our culture to start off celebrating all of these great wins because yeah, we can lament that the resources aren't there to do this or do that or replace, but we make it happen every day despite the limitations. And so we need to not be focused on what we can't do, but focus on what we are doing and what we still hope to do. So lots of hope that, some of the things we don't have will come, but in the meantime, we're saving lives every day. We're bringing lives into the
yeah.
world safely every day. We're patching people together today after some of the worst, most unimaginable events through
Yeah.
our level one trauma center. So we just have too much to celebrate, and we have to acknowledge that every day.
Yeah. I mean, you've said it in different ways that this work it's bigger than medicine in many ways. What's the bigger part,
Yeah,
for
I
you?
mean, a lot of institutions are doing medicine. You know, my father kind of, immigrant father said, "Oh, the way to have a good life for yourself would be to be a doctor." And so I think from an early age, I heard I was going to be a doctor. So yay, thanks, Dad, I'm a doctor. But what I got to choose for myself is who I'd be serving. And so when I was, in medical school and when I was in training, I got to see some different looks. I got to see institutions that catered to, more 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 affluent communities, and I saw
Yeah.
institutions that catered to not that. And so being able to see like safety nets in action, being able to work in a system that the motto was we take care of everybody regardless of your ability to pay, and seeing people from all over the world speaking all kinds of languages, all different socioeconomic levels, and being able to give them whatever they needed, not thinking about, oh well, you know by the way, they don't have insurance. So, and then catering your treatment plans and trying to get them out, none of that. And so I
Yeah.
said, that's absolutely the kind of medicine I have to practice. And so
Mm.
that's why being here at Sinai Chicago that embodies that same ideology is just the most incredible place to be.
So you mentioned about kind of your beginning. Maybe we touch on your a little bit of your origin story. Um, before the titles, before being a physician, uh, who were you? What like tell us about that. Like, how'd you grow
Yeah,
up?
no, I was a tall, lanky, awkward girl, black girl in with a funny name, and you know, very as a result was very introverted and
Mm,
kind of just teased a lot, bullied some, um, but my father was an educator and he just really believed in the power of education. And so I was able to focus because that's all my dad could think about is like, okay, you know, what'd you get on your math test? And it's like, oh, I got a 97. Oh my goodness, what happened to the other 3 points? Like, we could do better. So just striving for excellence, knowing that education was the way to go. Like I was steeped and soaked in that. And
yeah,
that opened a lot of doors, being able to be a strong student, even without having a lot of resources. So I
right.
was able to go to got admission to colleges that, my father had dreamt about, that he had read
Yeah,
about, and was so excited that his daughter could matriculate at schools that he had, read about in the old country. And just all of those doors opening, being able to do what you want to do, study medicine, and have medicine open so many other doors. I thought I would just see patients, for all of my career. I love having that window into somebody's life and being able to work with them on solutions to hopefully
yeah,
increase, not just their lifespan but their health span.
that's
And
right.
but the medicine actually opened many other doors and allowed me to work in different spaces and work in the jail and the prisons and consult around correctional facilities, really understanding that those individuals need care just as much as anybody else. Being able to be in public health and now be a hospital administrator. I'm really grateful for the doors that education has opened and
Mm.
allowed me to serve on a greater and greater and grander scale.
Yeah, because when I think about, I just kind of looked in your back. I mean, you trained in kind of two different worlds, right? You trained in adult medicine and pediatrics, which to me it doesn't seem as common. But why both?
Yeah,
And what did that kind of teach you about families and systems?
yeah. So I knew that first of all, I loved everything when I was going through, all the rotations, everything that I went to, I'm like, oh, I love it. I want to do this. Oh, I want, oh, babies. Oh, kids. Oh, psychiatry. Like I loved everything. So being able to do both internal medicine and pediatrics allowed me to do so much. And I was thinking in my mind in terms of, you know, if I wanted to do something like maybe mission work and you wanted to travel around the world, like the more you knew, the better it would be. So it has been just a great blessing to have that dual training that just gives you the
Mm,
broadest experience to be able to serve so many people.
yeah.
And it when I was working like on the west side of Chicago, it allowed me to take care of entire families as opposed to just
Yeah.
individuals. Because
Yeah.
I would see an adult patient, and then somebody, would be somebody would somehow find out that I see kids too, and they're like, "Wait, you see kids too?" And I said, "Yeah." They're like, "So you could see my kids?" And they'd be like, "Yeah." And so before you knew it, I would have like maybe like a whole 2 hours of like a family, like a
Yeah.
mom and multiple kids all trying to get like either their school physicals. But in seeing like 3, 4 people at the same time, you really got to peer into the setting, the family, the home,
Mm,
and understand how some of these medical problems are not about genetics and more about environment and
yeah.
socioeconomic situations and status. And so being able to see that very clearly, even 20, 25 years ago, now everybody's talking about, those social determinants, but I saw it by being the doctor for everyone and
Yeah.
having all the people in that clinic sometimes at the very same time.
Well, what's like a patient story that still you carry with you even today, even now as a CEO, as an administrator. Um, just a sidebar, some rules like no names, no identifiers, but just like the emotion of the story. I'd love to hear that.
No, I mean, there's so many. I mean, some that some situations that came up frequently would be seeing, you know, you know, you're measuring, the height and the weight, and you're calculating, the body mass index, and you're seeing visually and seeing with the metrics, like everyone in the family, is obese. And then you
Mm,
try to dig into it more, trying to figure out about, what are some of the strategies that we might look into to see how we can curb some of the weight gain. And you hear about a mom that's struggling doing at least 2 jobs, sometimes
yeah.
more, and saying that she would love to cook, but she's not often home, and the kids are kind of left to fend for themselves. And so, just understanding like how some of these, medical problems start even in childhood, again, is not related just to the individual, but kind of the circumstance.
That's right.
You could also notice how there are certain neighborhoods where you're trying to prescribe, oh, you have to have fresh fruits and vegetables, and it's like, we don't have a grocery store in the neighborhood, and the nearest one, I would have to take, X number of buses. I don't have a car. Like just
Some real
those
barriers.
those barriers just kept coming up over and over again as causes for some of the medical situations that you're confronted with.
Yeah. I mean, there's a difference between, serving a community and, I'll say, and belonging to a community. And how do you think about that line, as a leader?
Yeah. I mean, I think as if you're, being of the community versus just in it, that's how you build the trust. I remember at one of the clinics I was running, like diabetes was just rampant. And it was just
Mhm.
like, I don't think people even fully understood. Like they had diabetes, they might have hypertension. Um, and, they'd come to clinic and the blood pressure would be sky high. I'd be ready to almost call an ambulance. And they're like, oh, no, I didn't want to take medicine because I'm on multiple buses and it makes me have to urinate, and I didn't want to have to do. And it was like, but if you don't take it, and so it's just some of the understanding, and so it's the medical literacy. It caused me to like create what we called, it was the drive day, and it was
Mm,
something that we closed the clinic to like standard appointments, and it was basically like a community health fair that happened once a month, one afternoon a month, where we had pharma representatives who helped support the events, and we would just have educational sessions, and we'd have a blood pressure station, and then we'd have this in service on what it meant to have high blood pressure, and what are the numbers you actually want, and what is your A1C, and what do you want, really
yeah.
intensive, like fun food demonstrations on healthy cooking. Had that once a month, and it was so popular. People came and they actually learned more than what you could do in a quick 15 minutes trying to do all that, because people could take time, and we had like giveaways and stuff. And I just remembered like the difference in terms of people's understanding. There would be like foot checks to make sure that people didn't have like diabetic foot ulcers.
Yeah.
And as a result of that, people who would go to those drive days would come to the next visits, and they would be like, oh, and my number is this, and I know this is a little bit higher, the top number is a little bit higher than what it's like. You could just see the pieces coming together, and
Do
just
those still go on? Are those still ongoing, those fairs?
I'm not at that clinic now. I don't know if that still happens, but it was so successful. I hope it still is, but
Okay.
yeah, those kind of, kind of digging in and giving people what they actually need. I mean, we do that here at Sinai through our Sinai Community Institute. And that's why, when we say it's more than medicine, it's personal, like we live it. In addition to providing care like in the clinic or in the operating room, we're also in homes through our social services program. Like we follow up with families after they take that new baby home, and do surveys and check in and make sure that people understand some of the do's and don'ts of putting the baby on their back to sleep, to avoid some of the sudden infant death
Yeah.
syndromes and the like. Being able to follow a patient after they've been discharged with asthma, and just having a little check to make sure that they understand what those two inhalers are and know which ones to use, make sure they have that follow-up
Yeah.
appointment. And we've seen that those interventions actually decrease readmission and help decrease, some of these unfortunate infant deaths, which, we see high rates of infant mortality, in our community. So being in the community and part of the community is quintessential to actually being part of healing the community together.
Yeah. I mean, it just sounds like what you're doing is you're not limiting yourself to only the four walls of a hospital and the four walls of a clinic. You're saying, look, if we are going to be caring for this community because we are in this community, then it's got to happen outside of these doors. And it just sounds as though that I mean, you've publicly, been very vocal and focused on advancing health equity through, a lot of innovation. And I wouldn't just say innovation that's like more like theater. It's like, hey, these are practical, pragmatic ways that we can actually make things better. And it just sounds as though that you're proactively very collaborative with a number of community partners, and including, expanding that community health workers program, and even just investing in modern technology so that caregivers can actually work better and faster. Um, but when you say transformation, it can mean a lot of things. But at Sinai, what are like, if I was to kind of give you a whiteboard, what are like three things that you are trying to change and make better first?
Yeah. You know, we we say we don't have a lot of money, and you'd like to say, quote, money isn't everything, but the truth is you can't do much without it. And so one of the first things, and probably the largest investment that has ever been made in our system, uh, was 2 years ago when we when we implemented the new electronic health record system, the EPIC
Yeah.
system.
Yeah.
We had a completely antiquated, outdated system. We had multiple systems. If someone was in the hospital and then they came for the outpatient follow-up appointment, you look in one system to see what happened in the hospital, and you look in another system to get their vitals from today. Like it,
There's
bad,
no.
bad. And so, but the reason that it had never been upgraded is because the money wasn't there. It hasn't been there. It's not it's not here now, But it really was this really passionate, plea, to the board, to my CFO to say, look, I know we can't afford to do it, but we also can't afford not to do it. Like if we're actually going to evolve and if we're actually going to do the best that we can to take care of patients, you need a health record system that actually serves. And so that's the big investment that we made 2 years ago.
Mm.
Still trying to pay for it, but we already are reaping some of the benefits. We have better access to data, so you can use that, because in addition to having our community institute, we also have our urban health institute that does research, that is trying to
Mm.
see like what are we doing and what are the solutions and what solutions work and which ones don't. But you can't do that without good data. And so being able to have this electronic health record system is part of the transformation to be able to be an even better partner to the communities that we feel very fortunate to serve.
Yeah, I mean, it's like building a house. You got to
Yeah,
build a house on a good, sturdy foundation. You're not going
yeah,
to
exactly.
build it on like, cinder blocks, which I mean, I know there are some homes on cinder blocks, but I mean, you need a really sturdy foundation if you're going to put up something
Foundation.
that's going to be lasting and sustainable. What else?
So, we are trying to like get our message out there and not be this best kept secret. And so really trying to take a more public stance to assert what exactly we are and have people be comfortable and knowledgeable of what a safety net is. And so we've
Hmm.
been kind of on the offensive in terms of getting out there, trying to get in media, being more active on our social media, getting on radio and TV and the like, so that we can promote what we're doing. As we elevate, I think it was the first time that we actually went to like putting ads on the back of buses, right? Because we don't
Hmm.
want people to say, like, I have run into people, healthcare providers, and I say, oh yeah, I work at Sinai, and they're like, isn't that in New York? Like, no, it's right here in Chicago. It's right here in Chicago.
Yeah, I
They're
mean,
like,
yeah, they mix it up with, Mount Sinai. Oh, Mount Sinai, one in New York. You're like, no, no, actually, best kept sacred here in Chicago,
yeah,
Sinai, Chicago.
yeah. I did a TED talk where I was really trying to like really articulate in the clearest of terms what hospitals like Sinai do and why we're so quintessential. And I think we're able to get out a really good product that really speaks to safety nets and the incredible work that we do and the interlinking of our work to the health of the entire city. So just making sure that people understand. I've been creating partnerships with the more well-resourced academic institutions and really trying to like lock arms with them to say, so that you can keep doing what you're doing, we need to do what we're doing, so how can you support our work? I have to lift up Northwestern. They were the first ones that I approached, and we've come up with a almost a kind of donation program,
Hmm.
because our equipment usually goes well past natural life in terms of
Right, right.
when it should be changed over, and then you'll have frequent instances of, oh, the CT scanner's down, now we've got to shut down
Yeah.
radiology, and now we got to go on bypass because people can't come to the ED because, and now then you can't give the care. So worked with Northwestern, and they have been able to you know give some of their gently used equipment that they were going to recycle out and maybe go for upgrades. We've gotten some of that. And so what we've gotten is still a tremendous upgrade from,
Yeah,
some of the
it's
stuff
being
that we've had.
resourceful. Yeah, I mean, there's people that
I
throw
mean,
stuff out,
ideally
and I'm
I
just like,
want,
why are they
I
throwing
love
that
to,
out?
yeah. So we are trying to come up with, maybe unconventional, but, and I know some people say it's sad that you have to take hand-me-downs, but we have to think about the big picture here. And if I now have a 3D mammogram machine instead of the 2D that we had, I can now better serve these patients. And so we always got to think big picture, and keep
Totally.
making these steps. Like you were just saying how little wins kind of, they
They add
pile
up.
onto each other and
I
cause
know.
bigger wins. So we're getting them.
I'm just curious, like, what is a myth about safety nets that you just want to debunk right now?
Yeah, I think I'm not going to deny that aesthetics matter. They absolutely do. Everybody likes things that look nice. And so when you don't have the, you know, shining large, gleaming glass towers, then there's this perception that, oh, the care can't be good because look at the exterior. It's not new.
Hmm.
It's old. I know. I mean, I get my care here. My sister had surgery here. Like, I believe these doctors are some of the best in the world. I mean, our stats show it. Like, all the accreditations and licenses that we have. Our trauma survival rate is some of the best in the country. Our people are trained at all the wonderful institutions all around the world. We give incredible care here, and I know the patients who have experienced it definitely know it, but I don't think the rest of the world, knows the great, great care that is provided within these walls, despite the, less than brand new exterior.
Well, there's a lot of love in those walls. I can tell you that firsthand. And since you mentioned this earlier, I just wanted to kind of bring something to mind because you mentioned about um, going around and rounding. I call it, MBWA, managed by walking around, or just leading by walking around and being with your people. And there's something that kind of showcases to the teams that, like, you're there with them, you're kind of locked in arms with them. I'm curious, as you're going around and you're observing and you're evaluating things, what's like a one process inside the hospital that you are willing to completely rethink, even if it makes people uncomfortable at first?
A process that I want to rethink.
Rethink. It's like, is there a problem that you're like, oh man, like we really need to just completely do something completely different that we have been doing? Because everyone's like, well, this is just how we've always been doing it. Where you're like, no, no, I think we could do it differently.
Oh,
Do you have like a growing list of that? And
yeah,
what
no,
would be
my
on that
incredible
list?
leaders, like, they're all over that. Like, they're seeing the things, like, they're rounding as well. I'm not the only one rounding. Like, all of
Of
the
course.
managers, directors, and they're rounding consistently, and it's their job to find those things. I always like to throw. I mean, one of the things when I first came is, I would, sometimes I would be at one of the, reception stations, and I would see that someone was struggling who was clearly not as facile in English, but then there wasn't someone who was immediately able to help them in their language. And I ran into that a few too many times, and I just kind of pinpointed that and said, are we sure that we have, just enough bilingual people at all of our stations at all times? Like, we just have to be a little bit more intentional, because I've stopped too many times to do the translating myself. And then I said, and what we should also do, and we have them now. I just, like, where's my ideas?
Mhm.
We got badges that just said "Yo hablo español" and put it and said any caregiver. We call our staff caregivers.
Of course.
Anyone who speaks Spanish, like, let's wear that, because a lot of times, you might have somebody just, two seats over that does speak Spanish, but you don't know. But being able to have people see and know, oh, I see all these people that do speak Spanish. Let me go ask them. Another thing that came up in my tenure is like just wayfinding, and really excited that we were able to put up new signs all over the place so that you don't necessarily need someone to lead you, that we have signs that have arrows that are clear, that are in English and Spanish, so you can find your way through it's hard enough to be in the hospitals. Usually not, unless you're having a baby, it's probably a very stressful time. And then if you're feeling like you're lost and confused in this new place, that just adds to the stress and anxiety. And so
Mm.
really excited for the signs that help people find where they're going to go. There's just, we're like kind of in this plan, do, study, act, like all the time, this PDSAs where we're constantly improving upon processes. Like it's not a static thing. It's an everyday, get a little better every single day.
Yeah, that to me is is what innovation is, which is incremental. Well, my definition is it's adding value to many while incrementally getting better over a long stretch of time. And what I see is that when most are trying to innovate, they start, then they stop, and then they start over again, not having, done it consistently over time. Is there anything that you can kind of comment around just being consistent, being steadfast, even in seasons when it is really hard?
Sure. I think there's so many things. I think, again, I have to highlight that a lot of things that we know need to be done. It's you want to do it, but you don't have the resources. But when you get the resources, then that's usually when you can enact the plan that you've always wanted to have. Um, I think given
Well, what
some of
about the
the
idea that when you do have these financial constraints, which are very real and not trying to downplay them at all, do you find that there is greater levels of creativity and innovating? I'll call it, innovating within the box, within these constraints. Are you seeing that amongst the staff being even more proactive, just knowing what's at stake? And are there any really cool success stories that you can even name, yeah, even recently, what have you, that kind of attribute to the fact that there was a financial constraint, and yet, despite that, you were still able to sort of innovate through that?
Yeah, no, I know. I was just reminded when I went to the medical intensive care unit earlier this morning, um, that the rooms that were glass doors, that was like a COVID innovation where people, created in real time doors that you could see through so that you didn't have to keep going into a room with a patient with COVID, but could actually see like if they were okay or if they were asking for help. And like we didn't have, see-through doors before, but that was just out of ingenuity. That's what came up. There are so many examples of people just having, I think that the lack of resources is actually, it stirs and spurs on
Yeah.
that innovation because you've got to get creative. You've got to be nimble and agile and figure out a way, even if it's not something that you can afford, but you have to come up with a creative way to still get it done. I think that happens consistently here because of the lack of resources, and just makes people very sharp and just think think outside the box.
It reminds me a lot about honestly entrepreneurialism,
Mm.
because in many instances there might be a lack of funding, and a really good entrepreneur, what I've noticed is that if you don't have money, you have time. Meaning you could do certain things, you could write letter, you could do all these different things. And I'm just and there's you're obviously making bets because you're dealing with uncertainty, and you're obviously dealing with uncertainty on a day-to-day basis. And as you're making bets and doing trade-offs, I'm curious what is like. a bold bet that you've made. Um, you're not 100% sure that it's going to work, but like you're like, all right, this is a sound bet. I'm curious, like, what is that decision making matrix process that's going on through in your mind with your team, to the degree that you're able to share when you are thinking about, all right, we got to make this bold bet right now. Like, talk me through that process. That decision making process fascinates me.
Yeah. I mean, obviously the bet that we were going to sink in money that we didn't have to invest in an electronic health record system. I think we're still reaping the dividends. We're still mastering exactly how to use it. I don't think we're taking the full, you know, maximizing all of the capabilities. So that is something that's a gift that keeps on keeps on giving. An investment that we made. When again we didn't really have the resources was to go and secure vans for transportation, understanding that some of the difficulties for our patients stem from just the ability to get to an appointment.
Yeah.
And so we
Yeah.
actually, invested in vans and created a service of being able to get patients to and from their appointment, and actually saw how our show rates increased. Our no-show rates went down, our show
Yeah.
rates increased because we actually were helping get rid of the barriers. Not that people didn't want to be seen and didn't want to take care of their health, they actually couldn't get there. And so being able to make that investment allowed people to actually come in through the door, and you saw, our volumes and our numbers increase. The community health worker, but like you've already mentioned, is like just the biggest win-win-win when they're really hard to get, win-win-wins.
Yeah.
By having community health workers, sometimes, I mean, and they're doing so many different things. Some of them are circulating on the floors, making sure that patients are cared for. If our nurses haven't, rounded through recently, CHW could find out, oh, they need some water.
Hmm.
Oh, they need to go to the bathroom. Let somebody know so that we don't, we avert a fall. Sometimes they're in the community helping with educating people around certain chronic diseases. But that community health worker is now gainfully employed,
That's right.
now has health insurance themselves, and is helping members of their community access more fully the care that they need. So literally just a win-win-win. So as we continue to expand, different curriculums for different specializations for CHWs, we will continue to create more jobs in the
That's
community
right.
and have more people serving their own community and lifting, a rising tide lifts all boats,
That's right. That's right. Before we wrap, I just want you to be able to share with people where can they go to follow the work of Sinai Chicago, and just kind of 30-second commercial, tell them where to go so that there is no mistake in terms of them going to New York, but there's world-class care right here in Chicago.
Yeah, no, it's so easy. SinaiChicago.org. There you will learn about both Mount Sinai Hospital, also Schwab Rehabilitation Hospital. I think,
Yes.
a lot of people don't, you mentioned it, a lot of people don't know that there is another major rehab facility that is low tech, but super hands on with
Oh, yeah.
incredible results. There's Holy Cross Hospital. A Catholic hospital on the south side. And then there's the Sinai Community Institute and the Sinai Urban Health Institute, the social services arm, the research arm, all of that together makes up this incredible Sinai Chicago that has been serving the community for over 106 years and looking to do that for another 100 years.
All right. So let's just fast forward maybe 3 years. What would make you super proud of what Sinai became?
Yeah, no, I'm proud every day. I
Yeah.
think what is necessary and needed um, is the aesthetic. And so I would love to be you know, with the hard hat, breaking ground on a new building so that we can have um, an exterior that matches what's happening on the interior.
Lucky for you, I do know some good architects, which we'll talk about sidebar. But in all honesty, yeah, Dr. Ezike, thank you for just being so rigorously honest. You can tell that this is not just a job for you. This has a lot of purpose and meaning for you. There's a lot of folks, it's a calling. There's a lot of folks that are coming together and also see this vision and realize the need for it. So, for those that are tuning in, my hope is that you saw two things today. That A, when you think about innovation, you're not just thinking about brand name institutions, but you're also thinking about places that are maybe not cut from that cloth, and that there still can be world-class care that's being delivered day in and day out that is not headline driven. And that is Sinai Chicago. And then the second thing is that if you believe that you can help in any which way possible, then please reach out to me. Be glad to help and connect and make the connection here. So, if you tune in today and you're inspired by what's happening, just know that there is more. The best is yet to come. And if there is a topic that you want us to explore, or even a leader, a dynamic leader that you'd like to hear from, drop me a note, leave us a comment. If you don't mind, share this episode, reshare it, flag it, like it. That's super important. This platform for me, it's about community, it's about authentic community, it's not just content. So thank you for listening. Keep building with purpose, and we will see you next time on the Advancing Healthcare Innovation Show.